Hi everybody, Paul Devlin, Trust Chair here, and delighted to be with some really good colleagues, Robert Mooken and Natasha Garraway-Charles, who are the co-chairs of what's going to be our newly relaunched Embrace Staff Network for BME staff, and obviously along with John Bruin, Chief Exec. And we just wanted to have a little bit of a conversation. So Natasha, Robert, let's hand across to you to get us going.
Yeah, thanks, Paul, for that welcome. I suppose I'd like to start by asking, well, a statement first. You know, it's been 2 years, just over 2 years since the killing of George Floyd. And I know at that time there was lots of attention, lots of focus on BME network, Black and Asian and minority ethnic staff. And I'm just wondering, can you just give us a little summary of where we're at currently in terms of any actions or anything we've done as a trust to promote the agenda and to move us forward?
Yes, thank you. And I have to say, for me, part of it is just remembering the utter shock of actually seeing the murder of George Floyd, and just then seeing all of the reverberation that happened across the globe, but also happened in our trust as well. And I think it was really important for John and myself to be able to have conversations and listen to network members and the network leaders at the time about what that might look like. I think we've moved on quite a bit in terms of over the last couple of years. I think, John, it's probably fair to say that initially we were almost quite reactive, which was what is it we need to do? And I think one of the challenges that we got from colleagues was, well, you know, you need to be owning this stuff. You need to be taking a hold. And we did do some really useful sessions, I think, with the network. I particularly remember the network having John and myself in saying, you know, we don't just want the pat answers. We don't just want the policy stuff. We want to hear from you as individuals.
Thank you. So I just, you know, I think we as a trust are very privileged to have the chair and the chief exec supporting our agenda. And I think that puts us in a really kind of positive position. And I think some of the great work that we have done is because of your support. So I just wanted to, you know, just to kind of explain some of, you know, how you two as the leaders of the trust will support, has been supported the network.
Yeah, thanks, Robert. I'll start with that. Thanks for your kind words. So when I say the BME network embrace is really important, I need to follow that up with action. So there's a number of things that we've done to make that a reality, and hopefully it's, you know, for example, the number of people that are now part of the network and signed up and involved in it. I can't remember off the top of my head, but the numbers have grown significantly. I think we've helped that commitment in terms of it's a safe space, but it's more than just that. You know, it can be fun. There's so much to learn, and I come at it from a sense of, you know, relative ignorance in terms of my background, but from an organisation perspective, for the working environment that so many staff work in, it's tough anyway. But for all those you know, additional challenges around equity and inclusivity, we've got to, when we say it, we've got to follow it up with actions. And I think we're starting to do that. There's always more that we can do. It's been a really tough 2 years for everybody, but in the great scheme of things, you know, I'm relatively pleased with the progress we made, but always mindful that we can do more.
Yeah, thank you. Is there anything else, do you think, you know, that you want to include, or you want us as a network to support you? I know we've done a couple of board development sessions, but is there anything else you feel that we can support you in?
Yeah, thanks, Robert. I'm glad you mentioned the health inequality work, because that's really just begun, not just within the trust, but where it's a national initiative in the integrated care system in the county. And there's some really important disparity there, isn't there, in the various ethnic groups across our geography that I think if we can start to tackle, we'll have really significant positive impacts for people. Other things to note particularly, I think the work that the Freedom Speak Up Guardian and her team are doing in terms of, again, creating an environment where people feel more confident about speaking up, and particularly in the harassment, bullying, the attitude and behaviours arenas, a critically important part of the toolkits that we can use to improve things. One of the other areas that we've had conversation with recently within the group with you is around allyship, and the contribution that non-BME people can make into these conversations, again in terms of the culture and the way we do things around here. I think that again could be a real positive catalyst to moving us to the next level in terms of, and everybody's got a part to play in this, and it gets us away from that, here's another special group, that adds to the positivity of it. So they're just a couple of examples of work that we've started that I think will bear fruit and move us forward.
Guys, add as I know we're drawing to a close on our conversation, Robert, but I just think something that really helps as well is being able to get learning from other trusts. And I think particularly when we get new colleagues joining us, actually really doing a bit of work to find out, well, what's their experience and the good stuff that they experienced elsewhere. And I think there's something for me about the network keeping on telling us the stuff that we need to be doing, rather than the trust expecting that the network is doing it. Actually, the network is a great contributor, but there's stuff that actually we just need to be reminded that it's our job to get on with it. I think the final thing I want to say is just to put out a big thank you to both of you, and also to Angela Walker for your leadership over this last 2.5 years or so, in particular. I think you have really helped get us to the place of Embrace being able to launch like this, and it's a really exciting place for us to be. So thank you.
Thank you for your support.
So just to finish, to restate, Embrace is the new name. Is there a story behind that? Why you've chosen that particular? I think it's a great phrase, word, but why Embrace?
Yes, absolutely there is. I'll let Robert give you the technical explanation behind the name. But from my perspective, there's something so warm, inviting, nice about an embrace. Who doesn't like a nice embrace? Unless you're averse to touching, but there's something nice about that. And for us, it's about that inclusivity, championing that, and race equality is what we wanted to get across by that name.
Great.
Thank you.
It's a wrap.
Okay. So shall I just jot? Let's just see if we can get Jenny back.